I want to talk about two things today. One is a webinar by Dr. Michael Grieger from nutritionfacts.org, and he's got excellent, he always gives excellent advice, and he's very knowledgeable about health, and he does lectures all around the country, all around the United States, and I think the world even. He's got a webinar coming up called How Not to Die in a Pandemic. He'll have great advice about that. My advice to you, if I may, is to not panic about this and just keep calm, and because panicking isn't going to help anything. It's not going to help, and it's not going to prevent you from getting an infection. It's not going to help anybody. People are just going to panic, and like some people are doing in Australia at the moment, they're panicking about toilet paper. Seriously, and there's a very, very funny thing about from the Juice Media about that.
Message about the coronavirus. We know many of you are confused. Some say it's no big deal. Italians are freaking out. The Chinese are hiding out. And Aussies seem to think the virus attacks your butthole.
The Juice Media do great satire about different issues, and but it's full of information as well, usually. So check out the Juice Media on the coronavirus in Australia, and we're also not really governed very well by a right-wing kind of wannabe authoritarian Scott Morrison, so I'm not sure about his efforts to address this pandemic that's happening in the world today. Excuse the angle of this. I still have a broken arm, and I'm still recovering from this broken arm that I had, and it's very difficult to maneuver this camera, so just excuse me. I'm just going to read out something about the How Not to Die pandemic. It's on Wednesday, April the 8th, 2020, 2 p.m. This is online. It's a webinar by Dr. Michael Grieger. Last day to register is April 3rd. And he says that it'll be available after the fact, after it's been done, but you can actually ask questions if you wish during this webinar. So that's a good thing. And let's see. So what's the best thing we can do to keep ourselves and our families safe from the coronavirus? I'll leave a link to that, and you can read all about it. And it'll be available on nutritionfacts.org after that. A little disclaimer: I don't agree with everything that is posted on that site, or opinions or whatever, but it's an excellent site. It's science-backed, and he scans all the latest nutrition, science, medical journals with all these volunteers, so you don't have to, so I don't have to, and gets that information. And the other thing I saw today, and this is a good advice, like I can only share my own personal experience about this, but I sort of feel like it's best to avoid watching mainstream media, because I think they're doing a lot of clickbaity stuff, and they want people to get panicky and watch everything that they do. That's what the mainstream media is. It's about getting advertising and clicks. So they'll post anything that's going to get somebody to click it on, and so, there's just a gazillion things now about it. And as Dr. Grieger says, it's best to go to, if you look at his link to that webinar, go to reliable sources like the WHO and that sort of thing. I'm not sure about the CDC. It's underfunded terribly by Trump, so I'm not sure. But anyway, and this is something that I read, which I think is something we can all take on. I think this is really about isolating oneself to flatten the curve of the of this virus, to flatten the infection rate. I think that's a really good measure that we can all do, apart from increasing our immune system health by eating properly. I would recommend a plant-based diet, and that's what Dr. Grieger would also recommend. A balanced plant-based diet is the best way you can increase your immune system, because animal products are constantly assaulting your system. They're literally causing inflammation every time you eat animal products. So you're decreasing your immune system response every time you're ingesting animal products. So anyway, but this is something from an intensive care charge nurse in Toowoomba. It's a small town in Australia, and he's making this. He's in charge of the intensive care, and this is his suggestion. I think it's very, very good, and I would totally agree with this. His name is Visser, and he said, "I'm an intensive care specialist in a small city. Coronavirus isn't just like the flu. But it's only really dangerous to the elderly or the already unwell. Quite a lot of people in their 80s will die, but most of the rest of us will probably be okay. If you're in your 70s and you get coronavirus, you've got a really good chance of survival. If I've got a bed for you, he's talking about how many beds they have in ICU. If you're in your 60s and you have a heart attack, you've got a really good chance of survival if I've got a bed for you. If you're in your 50s and you need bowel cancer surgery, you've got a really good chance of survival if I've got a bed for you. If you're in your 40s and you've had a bad car accident, you've got a really good chance of survival if I've got a bed for you. If you're in your 30s and you have a terrible preeclampsia as a complication of pregnancy, you've got a really good chance of survival. I've got a bed for you. If you're in your 20s and you have a bad reaction to a party drug, you've got a really good chance of survival if I've got a bed for you. I have 7 beds equipped with life support machines. We have a plan to increase to about 25. Getting more isn't a matter of more equipment or more money. That bit is easy. There are not enough skilled staff, even if we all work double shifts every day for 6 months, and we probably will. If 50% of my city, and Toowoomba is not a big city, gets infected, that's 75,000 people. If 5% of them need life support, which is the estimate, that's 3,750 people for 25 beds. See, this is going to be a problem worldwide, so this is why this is very important. And then I might not have a bed for you. So it's up to you to flatten the curve. That means to do whatever you can, do whatever we can individually, to wash your hands, stay at home. And he suggests that there should be a lockdown, basically. I think that's a really good idea that people self-quarantine. Well, of course self-quarantine, but people should do whatever they can to prevent this from spreading. And that means just keeping everything down to a minimum and only going out when you absolutely have to, and keeping away from people and all that sort of thing. So it's really important that that's what we try to do, because as you can see, resources are not up to it, like 3,750 people for 25 beds. That's just in his hometown of Toowoomba, which is not, that big a town. So anyway, that's all good advice. So that's all I really wanted to say, was put out those two things about coronavirus, things that are positive, rather than I'm hoping I'm not contributing to the panic or frightening anybody. I don't think that's helpful for any of us, and it's certainly not good for our immune systems to be anxious and freaking out. And also, people need to stop panicking and buying gazillions of things and stuff. I mean, I can understand people wanting to make sure they have enough safe, if they have enough, but I think this craziness with buying toilet paper rolls and taking all toilet paper rolls away, and there's a lot of other things that people are buying up, is not helpful, really. I think people need to calm down and take that advice. It's all about, if the beds are available, because we need to reduce the number of people that get infected and that end up in intensive care units. So flattening the curve is something that we all can participate in, we can all do. And I live rurally, so it's a bit easier for me, but I still have to go out. We still have to go out and get things. And I have to go into the hospital. I have to go and have a hospital visit for my arm in about a week, which I'm not looking forward to, because it's at the Royal, I have to go into a major public hospital. And I'm thinking about when I have to get into the lifts, which are usually quite full. I may even wear a mask in those lifts, because you don't know who, I don't agree with unnecessarily using masks, but I think when you're going into a major public hospital and you have to get into a lift with a whole bunch of people, it's probably not a bad idea to wear a mask in that lift. And otherwise you can kind of keep away from people unless it's completely crowded, which this hospital usually isn't. That's something that I have to do because I injured my arm a while back, and so I have to have it checked out. But that's the thing. It's just reducing the amount of social contact we have with people, washing our hands really well, and making sure that we're, if we're touching things when we're out and stuff, and don't touch our faces. So anyway, that's great advice, and don't panic. Please don't panic. This too shall pass. I know that in the United States it's kind of crazy there because Donald Trump doesn't really know how to deal with public emergencies like this, and I don't think he particularly cares. He's up for re-election. I think that's probably why he's doing some things. But there'll be a lot of people in a dire shape there because, of the predictions that the amount of people infected might be great. So I have good thoughts for any of my US friends there. I have good thoughts for the world. I want everybody to be calm, and may this be a situation that actually brings people together, where we sort of think about each other as people and not as economic resources and all of this. Think about that it's all interconnected. This demonstrates how interconnected everything is, that we're just animals, really. This is a zoonotic disease from other animals, from our animal use. That's another reason of so many to go vegan, so many reasons to go vegan. Because all these zoonotic diseases like this COVID-19, SARS, MERS, all of those different, they're zoonotic diseases, which means it's animal to people transmission, because we've been exploiting and farming these animals and then eating them. And there's only going to be more, there's going to be antibiotic-resistant superbugs due to industrialized farming. Even free range is industrialized these days. So there's superbugs developing because they give tons and tons and tons of antibiotics in a prophylactic way to animals, and these bacteria become resistant. So this has been going on for a long time now. The prophylactic measures with literally millions of tons of antibiotics worldwide are given to animals in confined operations, and that includes free range and all of that. And it's actually used, of course, to increase the growth of animals as well, so that they can make more money off their bodies when they kill them. So this is a good reason another good reason. The main reason to go vegan is because animals are not our resources. They're not our property. They're sentient. And the other reason is because there's so many reasons. Climate change and climate crisis is another one, because animal agriculture is a major driver to the climate crisis. I'll leave a couple of memes about that, and of course our health. And you'll find out if you check out that webinar after the fact or during it, we'll realize how ridiculous it is that we're consuming these products of violence that are violence towards our body, and we're giving children those products too. And children now have early signs of atherosclerosis because they're eating animal products, and they're eating like McDonald's and all that, with all the animal products in them that just don't belong in our bodies. So, that's appalling, really. So we have to evolve and change, because this planet cannot sustain any more animal agriculture. It's destroying the planet. It's contributing to runaway global warming. It's contributing majorly to the sixth mass extinction. It's help create pandemics like this one, because this is sourced to eating bats or snakes or something like that at, wildlife in quotes, at wet markets in China, if that's actually where it came from. And also, our health. I mean, children having fatty streaks in their arteries when they're 6 and 7 years old, that's insane. That's not from eating plants. Okay, so anyway, these are all things we need to think about. And also, if you've watched the Chris Hedges, The Looming Food Crisis, animal agriculture is not going to be able to sustain the population we have in 2050 if we actually get there, which is looking less and less likely if you pay any attention to global warming and what's happening at the moment. But just say we get to 2050 and there's 10 billion people or whatever on the planet, animal agriculture is not going to be able to feed that many people. So we may as well let go or be dragged, basically. We need to end our animal use, all of us individually, and that means going vegan. And if we go vegan, then the supply will turn around. It's about us. It's not about capitalism, and it's not about the industries and everything. They wouldn't exist if we weren't creating demand. So all these sort of organizations that are talking, or these animal organizations talking about you need to boycott this industry and that industry, if we went vegan, those industries would have to find something else to make money off, and there wouldn't be any need for this. It's not how we're treating animals that is the issue. It's that we are using them at all that is the issue. So we need to get away from this paradigm about talking about animal welfare all the time, because it's immoral, and there's no non-abusive way to farm animals. There isn't. So we need to go vegan and end the use, and that ends the supply of animal products, which means that we address all these issues that I'm just talking about now. We address them all in one go just by being vegan. And I'm sorry if that's inconvenient for some people and you don't like what I'm saying, and then you go unsubscribe because you don't like you don't like that inconvenient truth, but that is the truth. I'm sorry. If we deny the science of animal agriculture and its huge contribution to the climate crisis, then we're science deniers. If we're going to pick and choose, like Scott Morrison, my Prime Minister here in Australia, he likes to pick and choose science. You know, he'll ignore science of the climate crisis because it's inconvenient, but he's freaking out about, I think, about his own health, about the coronavirus, and so he'll accept the science about that. You know, you can't just pick and choose science. Of course, you can be skeptical of some science if it's come from people, come from industries that have they're a stakeholder in keeping the status quo going. But this is actually this most recent largest study to date about animal agriculture and its tremendous devastation and tremendously negative effects on the environment, on land shortages, water use, eutrophication, acidification, and all of that, and the sixth mass extinction, and world hunger. If you look at this massive study, it's very clear, and these are not vegans that did this study, it's very clear that we need to be vegan. If we're wringing our hands about wildlife, in quotes, and what's happening to all the species going extinct, and we're not vegan, then what the hell are we doing, really and truly? You know, if we're freaking out about the climate crisis and we're not vegan, what on earth are we doing? We're either valuing our taste buds over our imminent extinction, really. That's how sad that is. So anyway, I'm digressing, but it's all related. So let's go vegan, and we can address all of this, including this zoonotic disease, coronavirus, which is a pandemic now. And I thank you for watching. My name is Trish Roberts. You're watching Faint Signals for Vega. Please subscribe if you haven't already. Click the notifications bell, otherwise you won't receive notifications when I drop a video. And please leave comments. I always am interested in reading your comments. Thanks so much for watching. Till next time. Bye for now.
Practice known as social distancing, and it's one of the most effective ways of reducing community transmission. Authorities say the risk of catching coronavirus in Australia is still low, but not impossible. It can happen through contaminated droplets spread by coughing and sneezing, or coming into contact with a contaminated surface. That could be someone's hand or an object such as a doorknob or a table. It's still unclear how long COVID-19 survives on a surface. Preliminary studies suggest it can be active between a few hours and a few days. So at any public gathering, even with good hygiene practices, you just can't be sure which surfaces may be contaminated. Authorities here can see the new restrictions are drastic, but lessons learned from overseas show they work.
This is a preemptive move to get ahead of the curve.
That curve looks like this: the number of cases versus how long it takes the virus to spread. Flattening the curve means extending the number of infections over a longer period of time so the health system can cope. If you've returned from an at-risk country, you should self-isolate for 2 weeks, even if you have no symptoms. If you haven't travelled but think you are sick, call your GP first. Don't immediately go to a hospital or a clinic. If you're unsure of what to do, call this number or visit this website for the latest official advice.